Deaths of racehorses during Derby week and the spring meet led to additional monitoring of horses in an effort to identify risk factors. WHAS 11's Conrad DeLuche explains.
There's nothing worse. There's nothing worse.
Louisville native and trainer Dale Romans lost Rio Moon in May 2023 to an injury. That was part of a string of deaths that eventually led Churchill Downs to move their spring meet that year to another track. In the time since, Roman says his team has monitored their horses more closely, tracking movements.
We're very close to these animals. And also the health and welfare of our jockeys is so important.
In the meantime, the Horse Racing and Safety Integrity Authority, known as HISA, has been examining exercise-associated sudden deaths. At racetracks subject to HISA rules, including Churchill Downs and Keeneland, 8% of racing deaths were considered sudden. Dr. Karen Hassan says in more than half of those, the cause of death can't be determined.
And those are presumed to be sudden cardiac death. And we don't know how many of those were atrial fibrillation or another arrhythmia. And that's where the research is going.
And out of horses closely monitored during a recent study, Dr. Hassan says the most surprising outcome was the effect of atrial fibrillation on horses.
They have heart problems just like people do.
Dr. Hassan says if a horse has AFib, they should not train. They're currently working on an ECG wearable device for horses that would be able to monitor conditions in real time in hopes of preventing some deaths. In Louisville, Conrad DeLuche, WHAS 11 on your side.
HISA's last report measuring horse deaths shows that between April and June 2025, 3 racetracks reported 5 or more racing-related deaths. One of those was Churchill Downs with 7 deaths.